Hey, this is Peter Young. I'd like to talk to you a little bit about trauma and addiction. When we look at trauma, the three main traumas that people really associate with is acute trauma, post-traumatic stress, and complex trauma. Of course, there is domestic violence that fits in there as well as childhood trauma. Now, with this, the combination of a substance abuse and trauma, they actually feed each other. And when one gets under control, the other one will flare up and vice versa. The objective of treatment is to be able to treat both of them simultaneously and to be able to get the person to be able to get the coping skills that they need in order to deal with it. Now, when you're looking at something like complex trauma or post-traumatic stress, you're looking at more like behaviors that are a little unusual, such as hypervigilance. That's where someone is always on the lookout, not allowing someone behind them. Loud noises startle them very quickly. They get what I call a startle response. This startle response will cause us a problem with as far as the somatic response. That means the somatic nervous system is going to kick up, which is causing the anxiety feeling, that fight or flight. So what happens with it is the person gets into that fight or flight mode, and they're so afraid that they can't regulate their emotions, nor can they include logic into it. Now, when we have substance abuse, what happens with it automatically clouds our logic. So when we have logic already on hold, what happens is the post-traumatic stress gets to such a heightened level that it's unmanageable, and the person will continually use to try to mask those things. Remember, when we use either because we don't want to feel or because we do want to feel, and when we mask those feelings, it is very difficult for people to really come to terms. When you get into post-traumatic stress, you get people that disassociate. They disassociate from their emotions. Now, if they're already trying to hide their emotions and they're becoming distant from them, they have no way of managing or regulating their emotions. When this happens, now we have such a complex problem that the individual has no tools in which to work with it. So what we do a lot of times is we give the person coping skills. We teach them how to manage their anxiety, we teach them how to manage their anger, and we teach them how to manage their self-imposed guilt. So that's a brief synopsis on what trauma and addiction do and how they're interplayed.